Good morning. This is 1706 South University, well known in our family as 1706. The Zweifler family moved into this house would be like 60 years ago, and we had our family grew here, and of course the reason we were living here was to be close to my work. I worked at the University of Michigan Medical School and University Hospital, which is really pretty close to here. I was able to walk to work or take a bike and be there in 10 to 15 minutes, and that was an important part of our whole time here in Ann Arbor, was having this house and in this location. Smile for the camera. There we go. Today I'm going to take a walk over to the University Hospital and University of Michigan Medical School, and we'll take a look at places where I saw patients, where I taught students and did research. And most of the people who lived in these larger houses at that time were faculty at the university. Now some of the houses are student housing. The main development, the main thing I'm actually proud of that I did in medical school was we call this standardized patient program, what you would call bedside manner, how doctors talk to patients, how they draw them out, all that stuff. I started this standardized patient program. There was an award called the Preventive Cardiology Academic Award, and I got it. You know, I had a little budget, and I hired this young woman. She was my first standardized patient. I could write a book about it, but anyway, that was the beginning of this program, which eventually blossomed in many ways. Our house is right in here somewhere.
Okay.
We walked up to Oxford, went over here, went by the cemetery. This building wasn't here when I first started working at the medical school, but it contains a lot of the work that I was involved with. We're going to visit the standardized patient program offices, which I introduced here many years ago in a very modest way, and now it's been expanded, and we'll take a look at the facilities here. This is the space at the University of Michigan Medical School for what we call the standardized patient program. And it's a center for really teaching what I would call in general clinical skills, how you examine patients, but without having real patients, having patients who are simulated. I guess to make it very brief, I was interested in teaching medical students how to examine patients. For many years, the whole focus on it was how you do physical exam. How do you find heart murmurs or an enlarged liver or something like that. But I got interested in interviewing, how you talk to patients, not just touch them. And I saw a video from a group up in New England somewhere showing a student examining a simulated patient. Never heard about it before, but I said, my gosh, this is what we need to do.
Wait, I'll just take you right around in a circle here.
Okay.
Older textbooks of what was then called physical diagnosis, there's practically nothing about how to talk to patients. The resource we had for teaching was the sick people who were coming here to this medical center for care. These were people who were pretty sick and were hospitalized and in a bed in the hospital. And I used to go around, and then I got trained a nurse to identify people who had physical findings that were detectable, and not only that, that agreed to having students examine them. That was all the recruitment of a resource. I mean, you can imagine maybe that's a challenge. One of the big changes in medicine was to get people out of the hospital as quickly as possible, economically. So that resource for teaching was basically drying up. And anyway, you can see the appeal of simulation. As they say, after that was just history. This is exactly like if I took you into the Taubman Center, where I see patients in the clinic, this is what it looks like.
It's very similar, to that.
And
yeah.
these are the exam rooms.
Yeah, this is the student hallway, and each lab has 10 exam rooms. So we'll take students back to the lab, and then they would come in through here. I can keep this open. So this is kind of your doctor's offices. 10 rooms. You'll see on the end, these 2 rooms are what we call the large sim rooms. You can have a group of students in here for group situations and teaching. They're all set up the same. These are just smaller. And if you look up in the ceiling, the big rooms have
This is
cameras.
a doctor's office.
Yeah.
Yeah, remarkable. If you look around here, you see each one of these rooms is like a room in a clinic, but it's a dedicated space for teaching how to examine patients using simulation.
How many rooms did you have when you were?
Yeah.
Well, one.
Just one.
We developed a program, and the space we were in was any office we could find that was not occupied. And sometimes we got kicked out of space. We didn't have any dedicated space for doing this. See, this is where you sort of do a physical exam as well as an interview. And a lot of what they do in these rooms is physical exams with standardized patients. It's very exciting, really, to see the way this has evolved, and actually the money that has gone into it from the institution. I don't know what the budget of this program is, but it's got to be substantial.
How much did you start with your grant?
About $100,000. Anyway, it's just amazing, the space that's dedicated to this.
Well, let's head right
Sure.
this direction. I'll show you the control room, which is kind of a cool.
This space is the control room for the standardized patient program examining rooms. They're able to visualize interactions between students and simulated patients and an instructor. I've never seen this. This is pretty amazing facility now where one person who is a director of the whole program can really monitor what's going on in multiple spaces. And there you see, I don't know what's going on there, but that. Yeah, now this is a student who is practicing the neurologic examination as I'm observing this. And that person that she's working on is a standardized patient who will, after she's done, or even as she's doing stuff, will give her feedback on how she's doing it. This is actually a fairly tricky thing to do, to get that reflex. Yeah, so and again, the whole process is, there's 2 functions that these standardized patients have. One is playing a role, and then the other thing they have to do is, once again, is to give feedback. They're instructors.
Everything.
Do you still have SPs that were SPs when you started? Do you have,
Oh, yes.
Yeah.
Oh, yes.
Yeah, my understanding is that there are a lot of loyal
Very much
SPs.
so. We have some great veteran SPs, for sure.
I might get introduced to somebody and they say, "Oh, you're Dr. Zweifler. I'm one of your standardized patients." They really like doing it. They like being involved in teaching young doctors to be, and they appreciate the focus of what they're doing, teaching how to interact with patients. I was involved with a lot of things here in the medical center, but this particular program is, for me, one of the most important ones that I feel like I really, made it happen, and I really think it's very important. But I'm proud of it, and I'm just amazed, really. And what else can I say? That this is this is a facility that I couldn't have imagined, literally.